Hello, my name is Adam Gripton, and my talk for data for the conference is entitled Using Self-Organizing Models in the Planning of Large-Scale Vaccination Logistics Operations. First, let's explain what we mean by a self-organizing model. These models are typically comprised of agents that are free to make their own decisions in the course of a model simulation, and will make different decisions based on different stimuli. When scaled up, this can allow the system as a whole to react to different sets of conditions to achieve an overall aim. We see this here through the visual metaphor of the murmuration of a flock of starlings. The problem to which we will be applying the concept of a self-organizing model is that of planning for a nationwide vaccination operation. Such problems are complex logistics problems involving several different sectors, many different types of participants, and they're also highly coupled, meaning decisions made by each party can have effects on the optimality of the decisions made by many others. There are also problems of high social and political importance. Typically, we seek the optimal supply chain network for the effective distribution of physical supplies and staffing to achieve an aim of full coverage of a target population within a certain time frame. Getting this right is of crucial importance to public health outcomes, in particular by reducing the peak pressures on a country's health service. So although every country is different and will have a unique set of circumstances and externalities based on their geography and social demography, it still can't be said that any country dealt with the COVID-19 pandemic in an entirely perfect way. And the national differences in vaccination rollout efficiency is an example of this. So moreover, the pandemic frequently exposed a lack of forward planning in how best to distribute a vaccine once it was approved for use, often resulting in a haphazard and disorganized rollout that relied on reactive decisions rather than thorough central contingency planning. This results in overspending due to the inefficient use of the available resources, including the available capacity in vehicle fleets, which also causes excessive carbon emissions. So what should be possible? For most countries, what should be possible is to take a reasonably detailed description of the country's infrastructure, facilities, and geography, and produce some sort of ready reckoner facility that can suggest a ballpark estimate of cost and resources required for a nationwide rollout operation given a mission target and a set of constraints. This doesn't have to be detailed, but it should be comprehensive enough to give a high-level view of what facilities may be required for an efficient overall operation that can inform central planning. The key is that such a system could then apply to any country or state, such that if an administration wanted to test out multiple scenarios given an existing infrastructure, they would at least be able to achieve a rough first estimate of costs, which may already be more advanced than what was there before from a centralized planning perspective. Furthermore, although a vaccine rollout is the example here, such a system could apply to any large-scale rollout that requires transportation and national population coverage within a limited time frame. So what would a system look like in terms of its inputs and outputs? A basic description of the population can be obtained typically from census data, and if a country provides it, this would ideally be broken down by age bands to inform priorities for a medical logistics operation. Next, the transport topology of the country to be described. That could include roads, railways, waterways, ports, and should give the system sight of the most suitable routes for the operation, as well as the routes to avoid. An overall mission target should be set by the operator so that the required levels of resources can be scaled and assigned appropriately. Finally, although this is optional, the system may take an input of where the existing locations of fulfillment and distribution facilities are currently, if, for example, they wish to know how existing assets can be best put to use, rather than starting from a blank canvas. So the outputs would include recommended facility locations and utilization levels, the recommended approach to both long-haul logistics and choice of local fulfillment options, the expected size of the vehicle fleet, number of staff, and the inventory that would be necessary at distribution centres and warehouses. It could also flag where the initial conditions may have left some parts of the mission target infeasible, and of course an estimate of overall costs with all these factors taken into account. As an example, the simulations we have developed concern a mission target of nationwide vaccine rollout in Bangladesh. The population of Bangladesh is of fairly uniform density throughout the country, with high density particularly around the capital city and much lower in the rural extremities. Bangladesh also has significant logistical pinch points around the major river crossings. The data we obtained was to the granularity of a union, which is a demographic unit typically between 20 to 30,000 residents, as shown in the lower figure here. We were also provided with the locations of existing medical centre locations serving each local district, which were also fairly evenly distributed. For the geographic layer, we used an online resource allowing bulk download of OpenStreetMap data, which contained the topology of the road network. The rail data was available, but we didn't use it at this stage. So the main applications of agent-based modeling to a vaccine logistics operation are as follows. As agents can access cost models and choose from between different options to achieve a target for the lowest cost, this could include whether to exist in the first place, decisions about inventory and staffing levels, the fleet of vehicles able to deliver to the hinterland, and so on. At the start of the simulation, a mission target can be set, for example, to vaccinate X% of the vulnerable population within a set number of days. The overall effects on costs are visible to each agent when making decisions. At each stage, agents are making low-level decisions about the most efficient way of achieving instrumental goals, usually by balancing cost trade-offs. These could include the capital costs of buildings and equipment, inventory and depreciation costs, for example, fridges, delivery costs, and staffing. And finally, the capability of agent-based modeling to assess a large class of scenarios quickly can lend itself to tasks such as finding a minimal effective set of facility locations, appraising the effects of varying delivery costs, or the feasibility of running buses to remote locations, amongst others. As an illustrative example, suppose a facility existed with a catchment population of 125,000 and the mission target required 20% of residents to be vaccinated within 50 days. So this would induce a daily demand of 500 vaccines per day for this catchment. If we assume that a vaccination team can administer 150 doses per day, this also means we need to employ 4 teams on site. If a fridge can hold, say, 5,000 doses, the facility agent has a financial choice to make concerning the trade-off between inventory and delivery costs. For example, if 1 fridge was present, a delivery would have to be made at least every 10 days, whereas with 2 fridges would enable a delivery to be taken only every 20 days instead. Defining a radius for the population that could walk to the facility, this may account for 120 doses per day in this case. After that, the facility has options on how to serve the remaining population, for example, running coolbox rounds at a certain frequency, or even subsidizing some remote residents to make their own way to the facility, possibly through buses. Cost optimality over this parameter space would be based on the best estimates for the cost models for each of these choices. As an example of how effects of these micro decisions can be inspected from a whole system perspective, if we now set the delivery cost as proportional to road distance from a main seaport, as we can see in this map, the facilities further from the port are making, on average, decisions to store more inventory, as the delivery costs start to dominate over those of keeping more inventory. As another example, consider an initial dense set of facilities, such as the network of clinics that already exist in Bangladesh, and the question of the optimal proportion of these clinics to use as part of the vaccine distribution effort, based on some fairly simple cost models about delivery radius and cost. Initially, this shows there are too many facilities for all to be included. Inventory and building costs could be saved from consolidation and implementing local delivery rounds. As facilities are iteratively excluded from the simulation, either delivery routes have to cover a larger area, or outlying populations will need to be subsidized for private travel, depending on the cost model and micro decisions by the remaining agents based on maximizing efficiency while maintaining the mission target. When too many facilities have been excluded, we see it as no longer economical to continue because of the rising logistics costs relative to inventory costs. The graph shows initial findings from use of basic cost models on the facility network present in Bangladesh, with the economics of closing facilities starting to fail when 90% of facilities are excluded in this example. So the direction of future work on this project is threefold. First, the delivery cost models used so far are fairly rudimentary. Once improved, they'll provide a better basis for facilities to make financial decisions to trade off delivery against inventory costs. Secondly, there is an ambition to let the model optionally designate certain facilities as major hubs, capable of receiving large shipments and then inducing lower delivery costs for all other nearby facilities, if this is an economically sound decision. Thirdly, a major goal of this research is to develop these concepts into a fully dynamic model, where in theory any facility could hold spare stock as well as serving its own catchment, with all facilities able to order extra stock from each other as the time-stepped simulation progresses. Thanks for your attention today. If you'd like to ask any questions at this point, please do feel free. Otherwise, my email's on the screen now, and I look forward to hearing from you.